Prime Minister is going to be chairing an all-important meeting on the continuous spike in COVID cases in the country, and that's going to happen in less than 30 minutes from now. At 11:30 this morning, this is breaking news coming in right now that the Prime Minister is chairing an all-important meeting to take stock of the COVID situation. Let me just check if we have Sunil Prabhu joining us. Sunil, please take us through the details.
Well, as you're well aware about what has happened across this country, there is an alarming situation. This is, of course, the second meeting in less than 2 days where the Prime Minister is going to review the situation. There have been a number of suggestions which have come from various political leaders, be it the Congress party, be it the chief ministers from Odisha to West Bengal to Maharashtra, as well as the BJP-ruled states. And I think the Prime Minister understands now that this is a disaster which needs to be averted. Every measure needs to be taken. The Chief Minister of Delhi already sending an SOS message in the national capital. Various other states also having the same problem. There have been 3 or 4 issues, if I can break up. One is, of course, about oxygen supply, which the government has already taken some steps. The Prime Minister himself has taken some measures. The second most important is the vaccine issue, where we have seen no less than the former Prime Minister, Dr. Manmohan Singh, writing to the Prime Minister after the deliberations of the Congress Working Committee, giving him 5 points to have a public and transparent process, try to help vaccine manufacturers. They were talking, and they had specifically in an interview to NDTV talked about 3,000 crores to ensure that they are given some kind of fill-up to get the required manufacturing uptake in terms of vaccines. So whether the government will go ahead on a urgent basis with or without cabinet approval to get that much important manufacturing of vaccines, apart from a transparent policy to ensure respective states get their demands. The last aspect, of course, is about hospitals, about infrastructure, and there has been a lot of complacency, as has been said by public health professionals somewhere down the line. And if you recall, no less than the BJP party had officially thanked the Prime Minister in its fight against Corona. Now, of course, it's come back to once again, and it's in this context that everybody is requesting them to keep politics aside and focus now on the core issue, which the Prime Minister will review, and hopefully some major steps are expected. Because if the numbers go beyond 3 lakhs, it's going to be extremely difficult for the government to control that situation, and something that he knows that he needs to take control of.
But that number looking almost inevitable at this point. Sunil, can I ask you this? Everybody hates the word lockdown right now, but by the hour, we see more and more states, even associations, some even linked to the BJP, saying that we need to put in fresh curbs. In the national capital, the Traders Association, which has for years been backed by the BJP, has lots of leaders in BJP coming out of that. They have gone into a self-imposed lockdown. In UP, for example, another BJP-ruled state, there as well, the most iconic market there, Hazratganj, gone into a self-imposed lockdown. Is that likely to be on the table at least when this meeting happens?
Well, we have spoken about this 2 weeks ago, if you recall, on a Sunday, about the top-down approach of a national lockdown. That, I think, has, unlike 1 year to this date, when the Prime Minister had appealed and enforced a national lockdown, asked for, 21 days. That's now history. It's unlikely that there will be a top-down approach of a national lockdown because, there are various states which have different parameters. But definitely, as Nirmala Sitharaman has been appealing to industry associations and the Home Minister has been speaking, there will be at various, containment zones, there will be the bottom-up approach where you will be left to district disaster management authorities, to state disaster management authorities to take these decisions where the situation is alarming. But a carte blanche across the board national lockdown seems highly unlikely, but we cannot rule it out at this stage. But definitely, you need the infrastructure. And if a situation is such, whether we are talking about beyond 3 lakhs, it becomes extremely difficult on hospitals, on the infrastructure, the health infrastructure that we have, because they haven't really learnt their lessons in the last 1 year. If we can't get our own oxygen cylinders at this stage, there is a serious crisis. There has been some complacency. Somebody needs to be held answerable, but that we leave for a later stage. At this stage, unlikely that a national lockdown, to answer your specific question, but definitely at various zones, where areas where the situation has gone out of control.